Well, with just 2 days until Halloween, Ohio has set another coronavirus record. Good evening, I'm Courtney Gooseman.
And I'm Frank Wiley. 3,590 new cases. That's almost 25% higher than our previous record. And it's nearly 1,000 more new cases in just 24 hours.
Now, this comes as more Ohioans are fighting the virus from hospital beds. There have been almost 200 new admissions.
Another 19 people have died. All the numbers are above the 3-week average. But Cuyahoga County remains in the red just 1 week after being warned it was on the verge of purple on the state's coronavirus advisory list. And we've learned every person in Northeast Ohio is living in a red or orange county. Governor DeWine and other leaders calling on people to do better. News 5's Amanda Van Allen brings our coverage to a start.
We all know what to do.
We must mask more. We must distance more. We must be more careful.
But according to the grim number of COVID cases in our state, we're not doing them enough. Today, there are nearly 3,600 new COVID cases, which is a state record, and nearly 200 new people were admitted to the hospital. Cuyahoga County was headed to the purple zone, but the governor says things leveled off.
Our alert system is designed to flag indicators that are getting worse. What we're seeing is that these 3 counties have plateaued at high levels. In Cuyahoga County, outpatient emergency visits are at an elevated plateau. Hospital admissions have been increasing. What we see in these counties is similar to what we're seeing in the rest of the state. Case numbers are continuing to go up. Healthcare utilization is trending upward.
He's now calling for county leaders to form a COVID defense team.
It should be in each county representative of the community. I'm asking the COVID defense team in each of our counties to assess and understand their situation, to inventory their assets in the community, and to focus on what steps to take to turn the situation in their community around.
Meanwhile, the city of Cleveland says it is going to continue its efforts of enforcement this weekend at bars and restaurants.
We will be out there enforcing, making sure that we're in compliance with the face covering ordinance. We're in compliance with social distancing. We're in compliance with making sure that we're adhering to all the local and state regulations.
Cleveland has seen more than 6,000 cases since the pandemic started. The city has been averaging 50 new cases a day for about a week, which is double the number of cases it has seen in the past. Mayor Frank Jackson says the city will continue doing what it's doing to keep cases down. He's open to a new plan, but is unsure of what that would be.
I don't know going forward what new things we will do. We will evaluate that as we're moving forward. And if we are declared a level 4 today or in the near future, we'll determine whether or not we'll take any additional actions or we'll double down on whatever it is that we're doing.
Amanda Van Allen, News 5.
And here's an in-depth look at why Cuyahoga County didn't go into the purple this week. In order to go purple, counties must hit 6 or 7 of the state's coronavirus indicators. This week, Cuyahoga County met 4 of them. New cases per capita, which means an average of 50 cases per 100,000 people over 2 weeks. Sustained new case growth over a 5-day period. Proportion of cases that aren't in a congregate setting, places like nursing homes or prisons. And sustained increase in hospital admissions. The county did not meet the indicators for a sustained increase in emergency room visits or outpatient visits, as well as for ICU bed occupancy. That indicator is flagged when the rate goes above 80% for at least 3 of the last 7 days. Last week, the county met 6 of the 7 indicators.